So this can be tied into having an invisible disability and always having people expect higher performances than is possible from them. One consequence of this is a disproportionately high dropout rate for students affected by FASD, as well as a higher chance of secondary disabilities such as depression, anxiety, and other mental health concerns. Individuals affected by FASD have a disproportionately high suicide rate. This is why it's extremely important to take a strength-based approach when working with students affected by FASD. Students want to be successful, so identify their strengths and build upon them. If they have a diagnosis, their strengths should be included in the report. Because of numerous factors, including low functioning levels and experiencing so much failure, students affected by FASD are very vulnerable. Students with FASD often do very poorly in social situations. If you consider that the majority of communication is nonverbal and think about all the decoding, interpreting, and brain functioning that goes into reading all these nonverbal signs, it's not surprising that it is an area that many individuals affected by FASD struggle with. Because they are so often socially isolated and desperate for revenge, individuals impacted by FASD can be easy marks and are often talked into participating in a long list of negative behaviors. If at all possible, connect the student affected by FASD to a peer mentor and discourage them from hanging out with students who will take advantage of them. Remember that students affected by FASD have a significant desire to be liked. Show that you like them through compliments and positive feedback. The school system can be very hard on parents of students affected by FASD. Take the time to listen to the parents' recommendation. They know their child best. Every single year, a parent or caregiver has to advocate for their child and educate different teachers, EAs, and administrators. This is exhausting. Also, as a student gets older, there becomes less and less supports available to them within the school system. This is incredibly frustrating to parents and caregivers because the system is telling them they expect the students to become increasingly independent. But the literature and experts on FASD say that the individual will always have to rely on external brain supports and that they may never be able to operate independently. Help parents by reaching out to them and asking how to best support their child in the classroom. And honor their recommendations. Oftentimes, students affected by FASD have highly specialized diets because different foods have an impact on their behavior, or because they may not be physically able to digest or absorb nutrients from certain foods. If a child has a special diet, respect that and do not give food or food treats out in class. So this is an area where teachers often step on parents' toes. It's just best to stay away from food treats. Staying in school is a protective factor in individuals living with FASD, and so we really want to encourage individuals affected by FASD to stay in school and to graduate or attain a leaving school certificate. So individuals living with FASD are often affected by other medical and mental health concerns. Individuals affected by FASD may also be struggling with other physical disorders. There's also the possibility of different mental health disorders. So it is not uncommon for individuals affected by FASD to also be suffering from post-traumatic stress disorder because of trauma suffered in early childhood, or radical attachment disorder, or oppositional defiance disorder as a result of being placed into the foster care system. Once again, there is a disproportionate number of individuals affected by FASD within the foster care system. There's also a disproportionately high rate of individuals affected by FASD struggling with depression and anxiety. So when you see behaviors in class, remember that FASD may not be the only factor at work. A common myth about students affected by FASD is that they cannot learn. This is not true. They absolutely can learn, they just learn differently and may have to be taught a concept up to 1,000 times before they understand it. This can be frustrating for teachers, but persevere because they are worth it. Although every individual impacted by FASD is different, there are certain problem behaviors that many individuals affected by FASD struggle with, and they are the inability to learn from consequences and understand cause and effect, lying and stealing. They get it one day and then don't get it the next. They're impulsive, rigid or black and white, and literal thinkers, unable to apply learning from one setting to the next. It's important to look at these behaviors through an FASD lens. Unable to learn from consequences is a result of alcohol interfering with the development of brain cells. So instead of using consequences to teach a lesson, try to be as proactive as possible. If they get it one day and don't get it the next, this is likely a result of memory impairment. The majority of individuals affected by FASD will have some sort of memory impairment, so reteach the concept to the student. Do not say, "But you understood this yesterday," because it is not helpful. Lying is often also a consequence of memory impairment. Individuals may try to fill in the blanks of the memory or accidentally combine several memories together. It helps to think of lying as confabulation and remember that oftentimes it is not deliberate. Stealing can happen because of confusion over the concept of ownership. It is not uncommon for individuals affected by FASD to think that somebody only owns something when they are physically holding it. So teach what ownership is explicitly. Stealing, however, can also be a result of impulsivity. So individuals affected by FASD are often impulsive because their brain doesn't make all the necessary connections in time to tell them that something is not a good idea. Remember, this is a safety factor and encourage students who have problems with impulsivity to build in a 10-second waiting period before they do something. Gray area thinking requires higher brain functioning. Individuals affected by FASD may not have those abilities, which is why they are so rigid and black and white in their thinking. Remember that a student affected by FASD suffers from organic and permanent brain damage due to prenatal exposure to alcohol. Do not expect them to be able to control all of their behaviors and immediately learn from their mistakes. It is up for the adults involved in the life of the individual affected by FASD to build in external supports to make up for this individual's deficits. I cannot emphasize enough the importance of a strength-based approach. So to get you started on a strength-based approach, here are some areas where individuals affected by FASD often exhibit strengths. So they are often friendly, trusting, loyal, affectionate, compassionate, nurturing, highly verbal, wonderful storytellers, creative, determined, hardworking, energetic, highly moral, curious, a good sense of humor, and have a sense of wonder. So if you've noticed, a lot of these strengths are actually what could be considered deficits, but looked through an FASD lens. So highly moral, if you're looking at it through a deficit lens, you're going to say they're rigid, black and white thinkers and cannot compromise. If you're looking through a strength-based lens, then you're going to say they're highly moral. Trusting, if you're going strength-based, you're going to say trusting, but if you're going deficit-based, you're going to say naive, impulsive, and can't think of cause and effects. So think strength-based, it's going to be much more effective, and it is going to put everything off on the right foot. When preparing to have a student affected by FASD in your class, think about the following 5 factors. All 5 factors should be addressed for the student to be successful. The first is to look at specific learning disabilities, including any problems with memory and judgment. Think about what strategies you can use to accommodate for any of these deficits. Then think about their social skills. Can you partner the student with a leader in your class? Can you provide them with helpful hints about where to hang out, what is cool? Remembering that students affected by FASD often be explicitly taught implicit information. So it's really important to foster that student's sense of belonging, as it will be a good indicator about whether or not they will be successful in school, and it is a protective factor as well. Then, what is the student's athletic abilities? Are they a strength? Is it a way that they can be popular with the other students? And are they getting enough exercise in the day to manage their energy levels? And finally, what are the student's fine and gross motor skills? Are any extra supports required? For example, does the student struggle